بسم الله الرحمن الرحيم وصلى الله على محمد وآله الطاهرين. باسمي وباسم جامعة ذي قار، ابتداء من السيد رئيس الجامعة المحترم، وكذلك جامعة الشطرة ابتداء من السيد رئيس الجامعة المحترم أيضا، وكافة العاملون في الجامعتين. أبارك إلى أخواني في جامعة البصرة مؤتمرهم العلمي الدولي الخاص بعلوم الحياة التطبيقية، ويسرني ويسعدني ويشرفني أن أكون بينكم كباحث أقدم ما لدي من معلومة بسيطة لعله أن يكون بها فائدة لأخواني الباحثين. This is Mohammed A Hasan, Head of Biology Department, College of Education for Girls, ذي قار University. I got my PhD from UPM University. UPM University is high rank for last 2 years. It was ranking 100, maybe 153, while 7th for Asia. My articles or my manuscript evaluation of serum, selenium, chromium, lead and iron in children with autism in the car governorate by Mohammed A Hasan and Associate Prof. Dr. Mohammed A Hasan and Associate Prof. Dr. Ibtihaj Ahmed Kadhim. Introduction. Autism spectrum disorders refer to category of neurodevelopmental conditions that are characterized by dysfunction in 3 areas: social contact, communication, and stereotyped, limited or repetitive pattern of behavior, interests, and activities. Autism's etiology remains an enigma. Highly regarded researchers are of the think that there is possibly more than one cause, since the disturbance can have such different appearance: genetics, environmental poisons, neurological psychopathy, nutritional deficiencies, and sensitivity, all involved. Several studies have found trace elements play a significant role in autism. A person needs a specific percentage of heavy elements such as selenium, chromium, and iron to help him perform some important functional processes, the most important of which are brain functions, as they contribute to regulating the body's systems, especially the immune system and antioxidants. The main aim of this study to assess the concentrations of some trace elements and toxic metal as a biomarker in serum of children with autism according to age. Our outcomes were shown in the tables. There is many tables, but we put in this slide 4 only. The table number 1 shown age distribution of autism patient and control. This table expound the distribution of autism patients and controls according to age. In this table, the upper age was 10 years within age group from 8 to 10 years. The results on this table shows that the age group between 2 years to 4 years is more susceptible to autism disease, 40%, and the lower number was 8 autism patients, 26.67% in the age group of the 8 to 10 years. Also, it was found that the age group between 5 to 7 years was 33.33%, is medium between two group of age. I mean group number 1 and group number 3 respectively. While the table number 2 represent the distribution of characteristics in autism patient according to clinical features and symptoms. In this table, autism varies from person to person in severity and a combination of symptoms. There is a wide range of ability and properties for children with autism. Two children not appear or act in the same way. Symptoms can range from mild to severe and often change during the time. While the table number 3 demonstrates the distribution of autistic patients with and without the diet. Table number 4 demonstrate or represent the serum selenium concentration of studied group. Actually, the concentration of serum selenium shows marked decrease in patients group in comparison with the control group. P-value less than or equal 0.05. In this table, it was found marked decrease in the concentration of serum selenium in group number 1 patients in compared with the group number 2 and group 3 patients. But it was found no marked differences in the concentration of serum selenium between group number 2 and group number 3 patient. Also, it was found no marked differences in concentration of serum selenium between all groups for control group. So, selenium is an essential trace element having a very narrow range between deficient, essential, and toxic dose. In this slide, we want to show that the concentration of serum selenium and serum iron and serum chromium showed marked decrease in patients group compared with the control group. P-value less than or equal 0.05. It was found no marked also differences in the concentration of all that heavy element between group number 1, 2, 3 patient for control group. Also, it was found the concentration of the observed decrease in the serum chromium levels in the general group of children with autism in the agreement with many and earlier studies indicating lower hair chromium content in autism patients. For general conclusions, the current study proved evidently that there is more than one cause of autism, because the disorder can have one of the causes: heredity, environmental toxins, neuropsychopathy, nutritional deficiencies, and allergies, all that implicated. All that causes. The study found that trace elements play an important role in autism, as humans need a small supply of trace elements such as selenium, chromium, and iron for some functional aspects, and most importantly, brain functions, or CNS functions. They play a role in regulating body systems, especially immune system and antioxidant scavengers. Also, we conclude that the decrease in the concentration of iron in the brain leads to change in the processes of serotonin and dopamine. Also, cortical fiber conduction and medulla formation, as well as that lead is a toxic metal for nervous system, and the growing brain is subject to its toxic consequences, through its development can be dangerous growth, as it interferes with the physiological processes and natural and neurodevelopment of children. Also, children get lead poisoning from the ingestion of dust. For the first maybe 4 to 6 months of age, their hands and the toys. And children within autism, the problem arises not from high exposure, but rather low excretion of this heavy element, lead poisoning. Finally, thanks a lot for your listen.